have a very interesting case today. We have a very active gentleman, a very young 63. He has back pain, bilateral leg pain, and mostly right anterior thigh pain. He's had surgery in the past. He had a 4-5, 5-1, minimally invasive hemilaminectomies that did not improve his symptoms. So we're looking at this level to see if that's the problem. If you look at his flexion extension views, you can see that the L3-4 level is mobile, both translationally and angularly. I don't think that's a word, but you know what I mean. And here's the MRI. He's got lots of multi-level disc disease, so you got to refrain from trying to think you need to fix every single one, because that surgery is way too big, way too complex. It'd be like driving 150 miles an hour on the freeway. Way too risky. But if you look at all the levels, the 3-4 level is uniquely horrible. Facet fluid sign, lateral recess stenosis. And look here, when he's laying down, it's almost reduced, that spondy, compared to when he stands up and leans forward. So just looking at the MRI is not enough. The other levels look really good. There's no facet fluid sign. Postoperative changes as expected. Some mild stenosis at these levels, mild to moderate, but this is where it's all bad. So we're going to focus on this. We will do an Endo TLIF. So we'll utilize a combination of direct decompression and indirect decompression. So he's got a disc bulge on the right side, so we'll clean this up. But mostly we want to realign the spine and reestablish inner body height and lordosis. And just by realigning the spine, we'll achieve an indirect decompression. And that's why the Endo TLIF is going to be the perfect choice for him. We're all excited about his surgery, so he can get back to his busy lifestyle as soon as possible. And if all goes according to plan, he'll either go home tonight or tomorrow. All right, putting in the PSIS, patient reference pin. All right, we're about to get started. We have the patient reference pin in, very solid because he's young and got good bone. I'm going to use the nav dilator to map out where everything is before I make the incision. Yes, it's cheating. I agree. But you know, my mom always said, if you don't cheat every once in a while, you ain't not trying hard enough. I use all these lines for a variety of things. So now I want to basically identify the bullseye to the L3-4 disc space. That's right here. Now I make this line really long. Cheating, huh, Terrence? Yep, it's right on a bone spur right there. Look at that. Okay, so now that I started the perfect starting holes, now I can use the thoracic gear shift probe. So I'm going to stick this little tip in, and then I'm just going to go like this and wait for the pedicle to invite me in politely. And I'm going to politely go in. Yes, it's cheating. I agree. You know, my mom always said, if you don't cheat every once in a while, you are not trying hard enough. What kind of bone you gave me? Oh, thank you. Your bone is unbelievable. Oh! Wow. I'm going two-handed. Very good bone. You're going to have a great result so far.
Are you really loving it?
Yes, I'm loving it now. This is exactly why I don't like doing this surgery in somebody that has a PCC disc because it's so awesome. It's going to go. Yeah, that's the best. Oh wait, that's the laser. You have to be a really good contortionist, by the way, to be an endoscopic surgeon. I was hoping you were going to give me the purple one. Shut. Shut. That is good. Yep. Now. X-ray. X-ray. I see it. Expanding device. This is going to look stellar. I can already feel it. Shot and save. Shot and save. Shot and save. Shot and save. Woo, yeah. Shot. I can feel the end plate now. Shot. Oh yeah, it's rotationally very stable. But perfect works. That's the bullet nose. That's one end plate. The other end plate is right there. I'll get rid of all that other stuff. I like these long old time stuff.